How to overcome white coat hypertension. 7 smart tips for you. You feel it the moment you walk into the doctor's office. Your heart starts to race. Your palms get a little sweaty, and by the time that blood pressure cuff tightens around your arm, the numbers on the screen are through the roof. But here's the secret: for millions of people, that high reading has very little to do with their actual day-to-day health. It's a fascinating phenomenon called white coat hypertension. In this video, I'm going to give you 7 practical, science-backed tips to conquer that anxiety and ensure you get an accurate blood pressure reading every single time. So, what exactly is white coat hypertension? Simply put, it's when your blood pressure is high in a medical setting, but normal when you measure it at home. This happens to a lot of people. In fact, studies show that of all the people who get a high blood pressure reading at the doctor's office, as many as 15 to 30% may actually have white coat hypertension. But here's why you can't just brush it off as nerves. For years, the thinking was that it was mostly harmless. But newer, high-quality research has changed that view. The large, multi-ethnic Dallas Heart Study, for example, found that individuals with white coat hypertension had about double the risk of future cardiovascular events, like heart attack and stroke, compared to people with normal blood pressure. It was also linked to early signs of target organ damage, like increased aortic stiffness and signs of renal injury. This isn't just about anxiety, it can be an early warning sign that your cardiovascular system is overreacting to stress. Think about a patient named John. At home, his blood pressure is a healthy 125/80ths, but at every doctor's visit, it shoots up to 150/95ths due to anxiety. Without understanding this phenomenon, a doctor might incorrectly diagnose him with hypertension and prescribe medication he doesn't need, which comes with its own potential side effects. That's why getting this right is so important. Okay, so how do we fight back against this anxiety response? Let's start with 3 powerful techniques you can use right there in the doctor's office. Tip number 1. Master your breath with the 4-7-8 technique. It's incredibly simple but effective. Before the cuff even comes out, just sit quietly and breathe in through your nose for 4 seconds, hold that breath for 7 seconds, and then exhale slowly through your mouth for 8 seconds. Repeat that 3 or 4 times. This technique activates your parasympathetic nervous system. That's your body's natural brake pedal, and it directly calms that fight or flight response. Tip number 2. Practice pre-appointment mindfulness. The moments in the waiting room are often the worst. Your mind starts racing with what-if scenarios. Instead of scrolling on your phone, take 5 minutes for yourself. Close your eyes and visualize a peaceful place. You can also use a simple grounding technique. Name 5 things you can see, 4 things you can feel, 3 things you can hear. This pulls your mind out of that cycle of worry and into the present moment. Tip number 3. Control your environment. Don't be afraid to politely advocate for yourself. If the triage area is busy and chaotic, you can ask the nurse, "Is there a quieter room where we could do this?" A simple change of scenery can make a huge difference. It's also incredibly helpful to bring a trusted friend or family member with you for support. Now for some simple hacks you can use before you even leave the house to stack the deck in your favor. Tip number 4. The 30-minute rule. This one is simple. Avoid stimulants for at least 30 minutes before your appointment. That means no coffee, no nicotine, and no energy drinks. These substances are known to temporarily raise blood pressure, which will only pour fuel on the white coat fire. Tip number 5. The Potassium Power-Up. An hour or 2 before your visit, eat a potassium-rich food, like a banana, some spinach, or a sweet potato. Potassium is a crucial electrolyte that helps balance sodium levels and relax the walls of your blood vessels. It's a natural way to support a healthy blood pressure reading. Tip number 6. The Beet Juice Boost. I know, it might sound strange, but hear me out. Drinking a glass of beet juice, about 2 to 3 hours before your appointment, can have a remarkable effect. Beets are rich in natural nitrates, which your body converts into nitric oxide. Nitric oxide is a potent vasodilator, meaning it helps relax and open up your blood vessels, which can lead to a lower, more accurate reading. Those hacks are great for the day of your appointment. But what about the long term? Tip number 7 is your best defense. Make regular exercise a priority. Aim for at least 150 minutes of moderate activity per week. Like brisk walking or cycling. Regular exercise strengthens your heart, lowers your baseline blood pressure, and makes your entire body more resilient to stress. It's the most powerful long-term strategy for managing both your blood pressure and your anxiety. Now for a critical bonus point: how to get a definitive diagnosis. The only way to know for sure if you have white coat hypertension is to measure your blood pressure outside of the clinic. You have two main options your doctor might suggest. The first is home blood pressure monitoring, where you use your own validated machine to keep a log of your readings. The second is ambulatory blood pressure monitoring, where you wear a device for 24 hours that automatically takes your blood pressure every 20 to 30 minutes, even while you sleep. This provides a complete picture of what your blood pressure is doing throughout your day. Let's go back to our patient, John. After his high reading, his doctor suggested he monitor his BP at home for 2 weeks. The log he brought back showed consistently normal readings. This proved it was white coat hypertension, saving him from unnecessary medication and empowering him to use the relaxation techniques we've discussed. White coat hypertension is real, and the research shows it's something to take seriously. But you have the power to manage it by preparing correctly, using powerful relaxation techniques like 4-7-8 breathing, and most importantly, tracking your numbers at home to get a true diagnosis. You can take back control. This isn't just about getting a lower number, it's about providing you and your doctor with the most accurate information to protect your long-term heart health. If you found these tips helpful and this video valuable, do me a favor and hit that like button. It tells YouTube that this is important information that more people should see. And, of course, to get more clear, evidence-based health information to help you on your wellness journey, make sure to click that subscribe button. Thank you so much for watching.